All right, well, thanks everybody for being here tonight, and more importantly, thank you for being Medica members. So my name is Stacy Alness, and I work at Medica, and I am the account rep for the Education Minnesota retiree plan. So today we're going to go over some of the changes and what's going on with your plan design and all that stuff and what the 2019 is going to bring us. So as most of you are aware, your plan is going away. So the Medicare cost plans are going away. And that was a decision made in Washington. That was not a decision that Medica made because we would never have made a decision like that. So that was a decision made in Washington where if there are more than two or at least two Medicare Advantage plans in the same county that have at least 5,000 members or more in each one of those plan designs, the cost plan can no longer be offered in that county. So as you will see, that majority of the counties in Minnesota will be, the Medicare cost plan will be exiting. So effective January 1st, the Medicare cost plan will no longer be offered in 66 of the counties in Minnesota, and those 66 counties are highlighted in teal on the map. So if you permanently reside in one of those 66 counties in Minnesota, your Medicare cost plan will be ending at the end of the year. If you're in one of the counties in white, one of the 21 counties in Minnesota that remains in white, the cost plan will be able to remain in those counties because there are not two Medicare Advantage plans currently selling insurance in those counties with at least 5,000 members or more in those plans. North Dakota, South Dakota, and Wisconsin, those will remain Medicare cost plans as well. So if you have a permanent residence in one of those counties, you will remain on the Medicare cost plan in 2019. But if you are one of those individuals that will be losing your health insurance coverage starting January 1st, 2019, no need to worry. We are going to automatically enroll you into a new Medicare Advantage plan starting January 1st, 2019. So you do not have to do any sort of paperwork, fill out new applications. We're going to do all that on your behalf and automatically enroll you into a new plan design. And we'll go through those plan designs in a couple of slides. So these are the Medicare Advantage counties in Minnesota that are listed. They are also in your pocket as well. So if you're in one of these 66 counties up here, you are going to be going off your Medicare cost plan at the end of the year and will be automatically enrolling you into a Medicare Advantage plan. If you're in one of the 26 counties listed here, you will remain on the Medicare cost plan in 2019, as well as if you live in North Dakota, South Dakota, and Western Wisconsin, you will remain on the Medicare cost plan. So in order to be eligible for the Medicare Advantage Solution Plan, once again, you have to be enrolled in both Medicare Part A and B. That's no change from 2018. You still have to continue to pay your Medicare Part B monthly premium. Once again, can't get away without paying that Medicare Part B monthly premium. You cannot have end-stage renal disease prior to enrolling in that plan, but that does not apply to you because you are all current Medica members, so that's a non-issue. And then you have to have your permanent residence within the Medica service area, the 66 county Medicare Advantage service area, to be eligible for the Medicare Advantage plan. In order to be eligible for the Medica Prime Solution cost plan, still same thing, you have to have your Medicare card with both Medicare A and B on it, continue to pay that Medicare Part B monthly premium, can't have end-stage renal disease unless you're coming off a Medica plan, which you all are, so that's a non-issue. And then you have to reside in one of the Medicare cost plan counties, which would be the 21 counties in Minnesota, or North or South Dakota and Western Wisconsin. I'm going to hold questions until the end because this is being recorded. So write it down. Write it down. All right. So Education Minnesota and Medica will be offering 2 plan designs in 2019. And so the first plan design that we're going to be talking about is the high option plan. And so for those of you who are currently on the high option plan, you currently have a group number of 70123. In 2019, we're going to be calling that Plan 2 because that group number is going to be changing. If you are going on a Medicare Advantage plan, you will be getting a new ID number, or excuse me, a new group number. So the 70123, which if you have a high option plan, that's your current group number, that will be changing in 2019. Currently, you have a monthly premium of $300. So this is great news because the premium is actually going down. We don't get to say that often in the health insurance. So this is exciting news that we can say that your health insurance premium is going down. And it'll be $273.10 a month. There are a few benefit changes with this plan. So we will highlight those. The first one being the outpatient hospital copay. Currently, you have a $50 copayment for any sort of outpatient hospital visits, and that is going down to a $0 copay in 2019. An emergency room copay. Currently on your plan, you have a $65 ER copay. That is actually going down as well to $50. But the ambulance copay is going to be split out into 2 going into 2019. So if you take an ambulance by ground, you pay nothing. But if you take an air ambulance, there will be a 20% co-insurance that you will be subject to for air ambulance. But it does go towards your max out of pocket. And then durable medical equipment. Currently, you pay nothing for durable medical equipment. That is going to be changing to a 10% co-insurance in 2019. And then your max out of pocket for medical services. Today it's $1,000. It's going up to $1,500. So all these medical benefits will go towards that $1,500 max out of pocket. And then there is one additional change to your Part D benefits, and that is, so today you pay up to a $10 copayment for a Tier 1 medication, and for a Tier 2 medication, you pay up to a $20 copay. Tier 3 medications, up to a $35 copay. Tier 4 medications, up to a $65 copay. And Tier 5 medications, currently you are paying a $100 copayment. In 2019, that will be changing to a 25% coinsurance. So instead of paying a flat dollar amount for those Tier 5 medications, you'll be paying a percentage for your Tier 5 medications. So that is an additional change for 2019 as well. So those are the changes on the high option plan for 2019. For the lower option plan, for those of you who are currently on that plan, you have a group number of 70125. Once again, if you are going onto a Medicare Advantage plan, you'll be receiving a new group number in 2019. But the good news with this plan is that the premium didn't change. So currently you're paying $138 and you're going to continue to pay $138 in 2019, and none of the benefits changed. So we did not make any changes to the low option plan. So we're trying to keep this as simple as we possibly can by keeping premiums and benefits as stable as possible through this transition, because we know it's on a lot of people's minds, and so we're trying to keep it as easy as possible. But do note that you do not have to do anything as far as fill out an application or any sort of paperwork, because Medica is going to be doing that on your behalf. We are going to auto-enroll you into the plan design, the lookalike plan design that's most similar to what you currently have today. So, and then as far as providers go, if you remain in a Medicare cost plan in 2019, it's business as usual. You still need to see providers that are in the Medica network in order to receive your highest level of benefits. But if you are somebody who is going to be losing your coverage and going on to a Medicare Advantage plan in 2019, you do have, our provider network is a little bit different than it is on the Medicare cost plan. So we do have a network of providers that you, under our Medicare Advantage plan. But the really nice thing about Medica's Advantage plans for our group plans is that in and out of network benefits are treated the same. So if you go see a provider that's not in the Medica network, but the provider accepts Medicare assignment, you will receive your in-network benefits. So this is special to our group plans. So a really nice benefit of being in an employer group plan is that our in and out of network benefits will be treated the same in 2019. So a great way to find out if your provider accepts Medicare assignment is you can go out on Medicare's website at medicare.gov and look up under their provider directory to see if your provider accepts Medicare, or you can, when you call and make an appointment, you can ask them if they accept Medicare assignment. Or if they're in the Medicare Advantage network, that's no problem. They're definitely in network then. But those are some other ways to see if the provider accepts Medicare assignment. You will have in and out of network benefits. So really nice benefit with these group plans for 2019. And then once again, both of these plans have the prescription drug coverage embedded in them. So don't go and enroll in any other Part D plan out in the market, because you will lose your medical and your pharmacy benefits because the Part D is embedded into the plan designs. And that is not a change for 2019. Our formulary, just per usual, every year the formulary does change slightly. We don't expect huge changes for 2019 either. We have over 3,200 medications on our formulary, and you can view Medica's formulary on our website at medica.com. You can also view it on Medicare's website at medicare.gov. But it is important to go out there, make sure your medications are on the formulary, and look to see which tier they fall into. But like I said, we don't expect large formulary changes for 2019. But every year, you know, there are a couple medications that they do make some changes to. And then with these plans, we have over 67,000 pharmacies nationwide, so you can pretty much get your meds wherever you'd like. Target, Walmart, Costco, CVS, you can go to any of those local pharmacies and get a 3-month supply for 3 months copay. We do have a mail order program through CVS Caremark where you can get a 3-month supply for 2 months copay on tier 1, 2, 3, and 4 medications. So if you're on some maintenance medications, feel free to get them through the mail order and save yourself a copay every 3 months. So now we're going to talk about some value-added benefits that go along with these plans. So the first one is our Silver Sneakers benefit. And so this is a free membership at any of the clubs that participate with Silver Sneakers. And there are a lot of different clubs that participate. A few examples would be Anytime Fitness, Snap Fitness, YMCAs, YWCAs, community centers. So there are a lot of clubs that participate. And new in 2019, the gold and the bronze lifetime fitnesses will also be participating. So that's going to be a change in 2019, is that lifetime will now be participating in silver sneakers for their gold and their bronze clubs only. And you don't have to go 8 or 12 times a month in order to get this benefit. Once you enroll in our plan and become a Medica member, we'll send you out a silver sneakers card in the mail. And then that will allow you to be able to belong to more than one club at the same time. So if you like to go to the YMCA, take some classes, but Snap Fitness is right around the corner and really convenient, you can go in between clubs free of charge with this plan. And with Silver Sneakers, this is a national program, so it will travel with you. So if you plan to spend 5 months in Arizona, 7 months in Florida, you can take this with you and find a club down where you plan to stay for an extended period of time. And then we also have our 24-hour, 7-day-a-week registered nurse line, as well as our 24-hour, 7-day-a-week personal health advocate support line. And what the support line is there to do is just help you navigate the often complex healthcare system. They're there to make your life easier. So if you have questions on finding a new provider that's accepting new patients, they can help you do that. Or if you have a bunch of doctor's appointments you need scheduled, they can help you do that legwork. So they're there to make your life easier. And I really do recommend the service because our members that use the Health Advocate absolutely rave about the wonderful service that they receive. And then we also have our personal plans portal. So you can go out to mymedica.com and you can set up a username and a password, and you will have access to your personal portal where you can view your claim information. If you lose your ID card, you can order a new one. There's pharmacy resources out there for you. There is information center with all sorts of information, and it keeps track of your max out of pocket for you. So really nice online tool to help you keep track of your health insurance information. So now what to expect during this transition period. So like I stated earlier, if you are somebody who is losing your Medicare cost plan because you live in one of the 66 counties that will no longer be offering the Medicare cost plan, we are going to be sending you a notice of change letter about the week of October 22nd. The mailings will start to arrive in people's houses, and it will be spread out between a week to 10 days. Because we, of course, can't do all mailings in one day. But you'll start getting that. And in that notification of change letter, it's going to highlight what you currently have in 2018 to what you will have in 2019. So it'll be kind of a side-by-side comparison of your plan. And then we will also be sending out a summary of benefits in that mailing, as well as your 2019 evidence of coverage booklet as well. So those are the documents that you'll be receiving around the week of October 22nd. You'll also be getting a new member ID card, and that will come out in December, probably the middle of December. You'll get a new member ID card, and if you're going on to a Medicare Advantage plan, you will have a new group number as well. And then we'll send you out a member packet, a verification letter, and also a confirmation letter just letting you know that you've been enrolled into a new plan design for January 1st. And if you are on the Medicare cost plan and you will remain on the Medicare cost plan for 2019 because you don't live in one of the 66 Medicare Advantage counties, it's pretty much business as usual. You'll get your annual notification of change letter, which you get each year, highlighting any changes that are going to be happening to your plan. You'll also be getting a new ID card in December as well. However, your group number will not be changing in 2019. You will have the same group number if you're remaining on the Medicare cost plan. And then you'll get your member renewing kit as well, which you get every year during this time. So thank you very much for being Medica members.